Hello guys. So now that we are done with embryology, so it is time that we move on to upper limb and lower limb. Okay. So see, for example, so what I have covered is embryology. The embryogenesis has been started. The rest of the embryogenesis and embryology and how it's gonna get delivered, the fetus has already been formed and how it's gonna be delivered will be dealt in obstetrics. Okay. That will be dealt in pelvis chapter. Okay, so now let's take the baby has already been formed and now the parts of the baby has been formed. So let us discuss the general embryology that we have already covered it. So let us discuss about upper limb and lower limb, because see in a so now that the baby has formed, it is gonna form the axial skeleton and the limbs, right? So now we'll be discussing about these limbs and the limb pathologies. Limbs will be discussed here itself, upper limb and lower limb. Then about the pathologies of upper limb and lower limb and all the musculocutaneous tissue will be dealt in orthopedics, so which will be the next chapter. Okay, so this I want you guys to be aware of where I'll be covering what topics. Okay, so now that we are done with embryology, we'll move on to upper limb and lower limb. Okay, so starting with upper limb, see in limbs, all I want you guys to remember is limbs have bones, muscles, the spaces, arteries, veins, and finally the nerves. So this is all and everything you need to know in the limbs. Okay, so starting with bones of the upper limb, we'll be starting with upper limb first and then we'll go on to lower limb. Okay, so the bones that are important here are scapula, the clavicle, and the carpal bones. So the rest of the upper limb bones, that is humerus, radius, and ulna, you need not know much about it, because this is not a first year exam or the first year theory exam that you're gonna go and give. So all and everything that you need to know just before your exams is these three bones and its importance. Okay, in scapula, so what you guys have to remember is the inferior angle of the scapula. See, if this is the scapula, the inferior angle will be at the level of T7. This is the vertebral column. Okay, so the scapula will be at the level of T7. That is all and everything you need to remember. Okay, then moving on. So the clavicle. Okay, so the clavicle, the beauty bone, that is which is in front of uh, your body. So this is the sternum, this is the clavicle. So the most important fact that you will have to remember is the most common fracture will be occurring in the lateral 1/3. So if this is the clavicle, this is a straight line and this is the lateral part of it, here is the part where the fracture will be happening. So that is all and everything you need to know about the clavicle. Then one more point about the clavicle is that it is the first bone to start ossification and the last to get ossified. Okay, so it is the first one to begin with, but it is the last one that the ossification will occur at. I mean, this is where the ossification will stop. Okay, so those are the 2 points that you will have to remember in clavicle. Scapula is done, scapula was done, then the scapula is done, then the clavicle was done. Clavicle, all you need to remember is lateral 1/3 the fracture will happen. Then this is the first bone to start ossifying and the last to get ossified. Okay, the process will start, the process of ossification will start first in clavicle, but it is the last bone to get ossified. One more point about the embryological genesis of clavicle is cleidocranial dysplasia. If you guys have seen Stranger Things, so there is the boy who will be having cleidocranial dysplasia, right? If you guys have not seen Stranger Things, so please after your exams go see it. But you guys yourself try to remember who that guy is. Okay, I'm not gonna tell you. So we all know that he'll be not having tooths, and one of the main thing is he's having cleidocranial dysplasia. Okay. So remember in that way, remember that person, and you will be able to solve this question of cleidocranial dysplasia. Okay, so here what happens is it is an osteoblastic issue. I'll tell you about what is osteoblast and osteoclast in orthopedics, but for now, all you need to remember is the cleidocranial dysplasia is the osteoblastic issue. Osteoblast is the bone forming cell. Okay, that is all and everything you need to know about clavicle. Moving on to carpals, this is the mnemonic that you need to remember. She likes to play, try to catch her. She likes to play, try to catch her is the mnemonic that you need to remember for carpal bones. Carpal bones, they'll ask you to identify which carpal bone is this. Okay. See, for example, scaphoid, lunate, triquetrum, all these things, right? Pisiform. So all these things they'll ask you, and they'll ask you to identify which bone is this. Okay. So if you know this mnemonic, you'll be able to solve that question. So the carpal bones will be arranged like this, right? So that you will be able to solve it like she likes to play in that way. Okay, so that is how you will have to remember about carpal bones. Then, so now that we are done with bones, this is all and everything you need to know about the upper limb bones. Okay, so don't learn more things about bones of upper limb. That is not much of use, and at the last moment, if you try learning all these anatomical stuff and all, definitely you will ruin your exams ability to revise. Okay, so that is why try to learn as much little as possible at the last moments. Okay, so bones is done, bones for upper limb is done. Moving on, so let us go to muscles of upper limb. Okay, so two major things that you will have to learn in upper limb muscle is, the main muscle is pectoralis major muscle. If we open the, see, I am opening this pectoralis major, and you will find another muscle called pectoralis minor muscle. Okay, pectoralis major muscle, pectoralis major muscle is this one. If I open that pectoralis major muscle, inside you will be able to see pectoralis minor muscle. Okay, so that's all. So when the so the nerve supply of these two muscles have been asked in the previous year questions. So for example, NEET PG 2024, they have asked this question: pectoralis major muscle and minor muscle. They have asked you to identify the nerve that pierces the pectoralis minor and major muscle. Okay, so they asked you the dissection image, and they asked you to identify the nerve. So the pectoralis major muscle is being supplied by lateral pectoral nerve, and the minor muscle is supplied by the medial pectoral nerve. Pectoral is the muscle, so the lateral part, because it is the lateral most, right? So this is the lateral most, that is pectoralis major. This is the chest muscle. When we do the dips and all, this is the major muscle that we'll see. Once I open this pectoralis major muscle, you can see pectoralis minor muscle. So this will be supplied, this will be the medial side, right? So medially it will be supplied by pectoralis minor, medial pectoral nerve. Okay, that's all about pectoral muscles. So other muscles of the upper limb, the identification of the cubital fossa, I'll be explaining to you later. So other than that, nothing much is important in muscle part of arms, or see, for example, arms, the forearm muscles, the hand muscles. Hand muscles is very important. I'll be explaining to you what are the important topics that you need to learn about hand muscles. Other than that, arm muscles and forearm muscles are not much of an importance for NEET PG. Okay. Then, so now that we are discussing the axilla, I mean, now we have finished bones and muscles, right? So we'll move on to the spaces in the upper limb. So while discussing about the spaces of upper limb, you'll be you'll come across mainly two things. Okay, so that is, one is cubital fossa and the triangles of axilla. Okay, so first we'll discuss about the triangles of axilla, and then we'll move on to cubital fossa. Okay, so these are the two spaces that you'll be required to learn. Okay, so in triangle of the shoulder, or the triangle of the axilla, so the upper border is formed by the teres minor. Please remember this is minor. Above is minor, not major. Okay, then the below border will be formed by teres major, the lateral border by the humerus, the medial border by the triceps long head. Okay, if you guys remember, you would have done the two finger and two finger from the right and two finger from the left, like this, and there are spaces that will be formed. This you would have done in your first years, right? So that is the spaces that we are discussing here. This is very important because three major structures that passes through these spaces. Okay, so that is why this space is very important. So the first space is the triangle that is formed by the teres minor, teres major, and the triceps of long head. Here the radial nerve will be passing through. Here, this in this space, the radial nerve will be passing through, and in the square it will be the axillary nerve that will be passing through. Axillary nerve will be supplying the deltoid. Then here the circumscapular vessels, the lower triangle. Okay, you need not know the names of these triangles and all, because that is not relevant. All you need to know before going to the exam is just where the nerves and arteries are going, so that you will be able to solve. If they ask what structure is in this space, is what the question is gonna come, and here what is the structure, and here what is the structure. That is the question that they are gonna ask. That is why I'm not telling you the names of those triangles also. You need not remember, because you will be you will start by hearting those triangles, and you will start forgetting all the other stuff. So that is why the anatomical names are not much important, rather than the what structures these spaces will be having. Okay, moving on. I'll come back to cubital fossa, but let us now that we are discussing the above part of the upper limb. See, this is the shoulder part, this is the arm, this is the clavicle, right? So we are discussing about this part, specifically this part. This is the axilla, right? We discussed about the pectoral muscles, and the pectoralis minor and major muscle, their nerve supplies. So that is why we'll finish off this part, and then we'll move on to the cubital fossa. So now that we are discussing here, we'll finish off the other major topic of shoulder muscle supply. Okay, the shoulder muscles, the shoulder muscle, that is the movement of abduction, which is supplied by three major muscles, or three or four major muscles. Okay, so the 0 to 15 degree, just the beginning of abduction is moving away from the body, adduction is moving towards the body. Please remember that. Please don't confuse between these two words. Abduction is moving away from the body, and adduction is moving towards the body. Please remember this. Okay, so the beginning of abduction is begins by supraspinatus. Just the beginning part is supraspinatus. Okay, what is supraspinatus? So for example, if we take this as the scapula, and this is the spine of the scapula, see here, this is T7, right? At the T7, the inferior angle of the scapula is there. It's very important to remember. Now forget it. So this is the spine, right? Spine of the scapula. So here, this is supraspinatus, this is infraspinatus. On the other side, this is from behind. Okay, from the back, if I'm dissecting dissecting the scapula, these are the two muscles that I'm gonna see after clearing off all the teres muscles, the rhomboid muscles and all. Once I dissect it, this is the major muscles that we'll be seeing in scapula. Okay, so and in front, this is from behind, and in front it is gonna be subscapular muscle. Okay, the supraspinatus is what begins the abduction, that is moving away from the body. Lifting of the shoulder will be started by supraspinatus, whereas from 15, this is 15 degree, then 15 degree to 19 degree will be by 90 degree will be by deltoid muscle. See, here the scapula was there and here the deltoid is there. Okay, so deltoid muscle, delt workout that we do in gym, right? So this delt is what the 15 to 90 degree of movement will be done by deltoid muscle. Then moving on, above, the trapezius muscle is there. Okay, so this is all I'm telling from behind. Okay, we are seeing a human body from behind. So trapezius and subscapular muscle. Forget subscapular muscle for now. So trapezius is what abducts the shoulder beyond 90 degrees Celsius. Okay, that is all and everything you need to know about the movement of shoulder. Okay, I hope you got it. Just before going to your exams, please go through this angle of a movement. Need not write a sticky note for this. I'll tell you what sticky note you need to write. Please, just before going into the exam, just go through this PDF and you'll be able to solve this question. So 0 to 59 is supraspinatus, 15 to 90 is deltoid, and beyond 90 degree it is trapezius. Okay, that's it. Then again, so we were discussing about the upper part of the upper limb. Upper part of the upper limb is what we are discussing. That is why we'll cover off the artery that is important in that part. That is, in first year, this has been a headache for all of the medical students. That is axillary artery, the parts of axillary artery and its branches, right? So we all remember, right? Pectoralis major, pectoralis minor. Pectoralis minor muscle is the key muscle of the key muscle. Why? Because the axillary artery will be divided into first part, the second part, and the third part by this pectoralis major muscle. Why is this? Because this. Why is this? Because this artery gives many branches out. Okay, see, these are many branches that the axillary artery will give rise to, and all these branches that has been formed will be divided by the parts or the branches that these axillary artery will form. So the first part is giving a branch called superior thoracic artery. See, axilla is there. Here the axilla is there. The pectoralis minor muscle is there. Here the artery is going. Okay, so this is the first part. This is the thorax. Okay, this is the thorax. This is the sternum. This is thorax. Okay, this first part is giving rise to superior thoracic artery, and this is the pectoralis minor. Beyond that is the second part, which is giving, this is the second part. Okay, this is the first part, this is the third part. First part gives one branch, second part gives two branch, third branch gives three branch. Okay, this is first year chapter. Please don't forget this. This is very important. Okay, this is clinically very important because many of the major surgeries of breast surgery and now the surgeries of myocardial infarction or CABG that we are doing, they have started grafting from inferior mammary artery and all. So that is why it is very important. So that is why these arteries will start the collaterals after the CABG has been done. So that is why this part of axillary artery is very important. Okay, so the first part gives rise to superior thoracic artery. The second part will give rise to The second part will give rise to lateral thoracic artery and thoracoacromial artery. Thoracoacromial meaning here, if this is the coracoid process, the thoracoid acromion, right? This is the acromion process beyond the coracoid process. Coracoid process is here, the acromion process of the scapula is here. So that is where the acromial artery will form. So that is why lateral thoracic artery, thoracoacromial artery will be given by the second branch. Now coming to third part, it forms the circumflex arteries, anterior and posterior circumflex artery. These are the two arteries. There itself you learnt it. Then the other one is subscapular artery. So scapula is behind. I told you, right, in from the front there will be subscapular muscle. So beyond there was supraspinatus and infraspinatus, whereas from the front it will be subscapular muscle. So this subscapular muscle will be supplied from the artery of the third part, that is subscapular artery. So these are the three branches that you need to remember. Okay, that's it. Don't come back again for this PDF again. So that is why I need you guys to write this down in your sticky notes. All and everything will be done. Okay, please write this in your sticky note so that before going to the exam you will be able to reach for it. Then now we are done with the clavicle was done. Behind it the scapula was there. Then the muscles of pectoralis major and minor muscle was done. What are the nerves that was supplied by this is done. Then moving down, it was humerus was there. Then here the radius and ulna. Then the carpal bones. Then phalanges and metatarsals, everything is there. Okay, behind it was scapula behind. Okay, so I'm drawing it in the front, but behind, this is behind. Okay, so this is all about the upper limb first part. Okay, here we discussed about the artery. Here the pectoralis minor muscle, which is the key muscle. Here the axillary artery was formed and it is going down. Before going down and forming the brachial artery, this is the brachial artery which will be formed from the axillary artery. But the before dividing it as brachial artery, before it forming as brachial artery, it will give rise to third part, second part, which is having two branches, and the first part, which is the superior thoracic artery. Okay, so that is what has been covered. Now moving down, it is the cubital fossa that has been asked number of times to identify. They are asking to identify what and all the structures that are present in the cubital fossa. So that is why I have picked the image that was asked in the exams itself. So let us discuss that itself. Okay, so this side is the lateral part, this is the medial part. Okay, so that is the orientation that I have to give you. So starting with the lateral most thing will be the radial nerve. So then after radial nerve, it is gonna be the brachialis muscle. Then after that, it is the cephalic vein. Then next to that will be the biceps brachii, the biceps muscle that you flex, right? So that is there. Then after that is the basilic vein. The basilic vein and the cephalic vein together form the median vein. From here is where in internship we used to take the venous samples, right? So here where we used to pierce it. Okay, here is where we used to pierce it, and next to that, next to the basilic vein is the median nerve. Okay, so next to that is the pronator muscle. Okay, so this image please learn just before going into your exams. Okay, so that is lateral most is the radial nerve, medial most is the median nerve. So lateral most is radial nerve, medial most is median nerve, Between that, the cephalic vein and basilic vein is there. Between cephalic and basilic vein, the biceps brachii that we flex is there. Then besides cephalic vein, there is brachialis muscle. So this is the orientation that you need to have before going into the exam. Okay, that's it. So now that we are done with the cubital fossa, all this is done, this is done, this is done, this is done, this is done. So we'll move on to the hands. Okay, so they are so examiners have been keen in asking about the hand muscles and their actions. Okay, so that is why we learn hand muscles has been a headache since our first year, but I'll make it easy for you. Okay, so there are only two types of muscles in hand. Okay, so remember, there are other thenar muscles, hypothenar muscles. Leave that, they are not asking it. They have been headache since the first year, and let us leave it as such. We are not anatomists, but the clinically important things will discuss, because they are interested in asking the clinical stuff only, right? So the clinical questions are gonna come. So from these muscles, hand muscles, we are having two types of muscles. One is interossei muscle, the other one is lumbricals. Okay, interossei has been divided into two parts, that is palmar interossei and dorsal interossei. All you need to remember is pad and dab. If someone asks you about hand, no, the first thing that has to come to your mind is pad and dab. Pad is palmar interossei will be adducting the fingers, whereas dorsal interossei will be abducting the fingers. Okay, so adduction, I told you, right, moving towards. Okay, moving towards is adduction. Moving towards what in hand? Moving towards the middle finger. Okay, middle finger. All these fingers, right, all these fingers will be moving towards the middle finger. Towards the middle finger is adduction. If the movement is away from the middle finger, then it is called abduction. Pad, the palmar side of the interossei will give the action of adduction, whereas the dorsal side of the interossei will give the abduction. Is all you have to remember here with respect to interossei muscles. Then coming to lumbricals, it is the metacarpophalangeal flexion. Metacarpophalanges. Okay, these are the carpal bones, these are the metacarpals, and these are the carpal bones. I mean the phalanges. Okay, so between the metacarpophalangeal joint, whatever the flexion that happens, right, between the fingers and the hand, that flexion will be done by lumbricals. Okay, so that is all and everything you need to know about the hand muscles. Okay, that's it. Okay, so now we are done with the muscles of the hand also. Okay, so we were done here, done here with the upper part of the upper limb. So just when I'm telling this now, just try to like orient yourself with what I learned. Okay, just there and then itself you start revising. Taka tuck taka tuck. Okay, here the clavicle was there, scapula, everything. Okay, I'm not gonna waste time. So just remember when I'm telling this, because I want you to go back and revise at the same moment that I'm telling you. So that is why I'm doing this. So upper limb, upper part was done here. Then I told you not to remember anything about humerus. So then brachial artery. Brachial artery is very important, because this is where we take BP, right? BP cuff here is this is what we try to occlude and start hearing the cough sounds, right? So that is why brachial artery was there. Then coming down, we discussed about cubital fossa, its orientation. That is, the lateral most part was radial nerve, medial most part was the median nerve. Between that, here the muscle of brachialis was there. Then next to it was the vein of cephalic vein. Then the in the middle, the biceps brachii came. Then next to it was median vein. Cephalic vein and median vein together formed, so cephalic vein and basilic vein together formed the median vein. Then medial most was median nerve. Okay, so that is the orientation of cubital fossa. Then moving down, we discussed about hand muscles, that is pad, dab, then lumbricals. Pad and dab is the adduction and abduction of the abduction of the fingers, whereas lumbricals gave the metacarpophalangeal flexion. Okay, so that's it. Then moving forward, we'll see the final thing about the upper limb, that is, since the first year, your favorite topic. And when you think of first year, the first thing that comes to your mind when you think of anatomy is brachial plexus, right? So brachial plexus is what we are gonna discuss. Brachial plexus, they have never asked anything about brachial plexus. Rather, they are keen in orienting towards the clinical cases that are important with respect to the brachial plexus. They have not asked any branch also. They have not asked any root also. The main thing that they are asking is from which root the particular nerve that was damaged has been coming from, or they are asking which clinical presentation the nerve damage is coming up with. Okay, so that is what we are going to discuss. Okay, this is the table that you need to learn. This is the exact image when you dissect the brachial plexus or the axilla. So here we discussed about the upper part of the upper limb, right? So upper part of the upper limb was discussed here. So here is where the brachial plexus is gonna lie. Okay, so brachial plexus will be having roots that comes from the cervical plexus. Okay, the cervical plexus, there are many plexus in the body which are like the nerve roots. Okay, so here it is the cervical plexus. Then in the lumbar region there is lumbar plexus. Then in the sacrum there is sacral plexus. These nerve roots come and form they help in forming the nerve roots of the limbs. Okay, so that is why the name plexus is group of nerves. So these plexus try to come out from the vertebral body and give rise to all these nerve supplies. Okay, so coming down, the first root, the brachial plexus is having C5, C6, C7, C8, T1. Okay, remember in that way, and it will make your exams very easy. Okay, C5, C6, C7, C8, T1. Okay, C5, C6, if it is affected, we will be having two types of disease. Okay, one is if the trunk of the C5, C6, and one more thing I forgot you to tell is we will be having trunks, the cords, trunks and divisions. Okay, the major, they have asked this in previous year exams also, that is divisions have no branches. Okay, we had learned, right? The brachial plexus will be having cords, divisions and branches that's gonna come. So the cords are there, the root is there, the divisions are there. So from divisions there are no branches. Okay, so that is all you will have to remember. Okay, please remember this point, and you'll be able to solve that question. Okay, then so now that we are discussing about the brachial plexus, C5, C6, the first thing above in the neck part. Neck, for example, let us take, this is the neck. Okay, so this is the neck, this is the arm, and this is the axilla, and here the pectoral muscle, chest is there, here the sternum is there, this is the arm. Okay, so if I'm talking about the part that I'm discussing about is this part. just neck and the shoulder. This is the shoulder, this is the neck. Okay, so C5 C6 will be in the upper part, C7 will be here, C8 T1 will be here. So all these things will form one root. Okay, and will supply the upper limb and upper limb. Okay, so that is what I want you guys to orient with. C5 C6, the uppermost, if it gets injured, it is gonna be Erb's palsy and flat deltoid. Okay, so the deltoid muscle will be supplied by axillary nerve, right? Where else did we learn about axillary nerve? Axillary nerve was the content of this space. Okay, I'm not gonna tell you the names of those space. Okay, you need not remember. That is why I'm not telling the triangle names also. Okay, so in that space the axillary nerve was there, so it will go and supply the deltoid. What did deltoid do? Deltoid did 15 to 90 degree abduction of the shoulder, right? So this is how you revise and do it, okay, at the last moment. So Erb's palsy and flat deltoid is C5 C6 injury. Regimental badge, you would have heard, right? Regimental badge sign, where the deltoids become flat. The shoulder, when you see a patient comes to you for the clinic, so you will be able to see the shoulders have been flat here. Okay, so that is why regimental badge, meaning, so in army people will be pasting a regimental badge, right? So that is how the flat, like it looks like a flat deltoid. That is why the name C5 C6. So if it gets destroyed or if it gets injured, it is gonna be flat deltoid. Then moving down, if it is C5 C7, it is gonna be winging of scapula. Where do we see winging of scapula? In the long thoracic nerve damage. Where do we see this? Exactly in MRM, right? MRM. What is MRM? Modified radical mastectomy, the breast surgeries. You would have seen this in your final year exams, right? So final year exam, final year case, viva, they would have definitely asked this question. If you while doing MRM, what is the nerve that will be damaged and what will be the presentation? That is winging of the scapula. Winging of the scapula. Why the winging of scapula takes place? Because long thoracic nerve supplies the serratus anterior, and serratus anterior tries to hold the scapula towards the body, but when the nerve is damaged, it tries to wing out from the body. So that is why winging of scapula. C5 C6 was Erb's palsy and flat deltoid, whereas C5 C7 is winging of scapula. Coming to radial nerve injury, so C5 to T1 and C5 to T1, from the first to the last, if it is getting destroyed, it is radial nerve and median nerve. Where did we see radial nerve and median nerve? Here in cubital fossa, right? So radial nerve was the lateral most nerve, the medial nerve was the medial most nerve. So that is where we saw the radial nerve and median nerve, right? So see here also, so from C5 to C5 to T1, all the roots will have the branching of median nerve and radial nerve. Okay, it is very unlikely that we get to see the damages of the roots, rather than we'll get to see the destruction um, in the this itself, where in the branches of the median nerve and radial nerve is where we get to see the damages, but they won't ask you about the damages of the roots, but rather than they'll ask you what is the root of these nerves. Okay, so that is why I told you C5 T1, if they are discussing, it is going to be radial nerve or median nerve. If radial nerve gets damaged in the axilla, we are gonna see something known as claw hand. I'll tell you why do we see claw hand. Okay, then if it is getting destroyed in the shaft of the humerus, it is gonna be claw hand again. But if it is gonna be a Montague fracture, it is gonna be posterior interosseous nerve. It's gonna get damaged, and we'll be seeing the claw hand, but not as extensive as we see in destruction in axillary branch or in the shaft. When the radial nerve is following the tract, right? If it is gonna get damaged in the axilla, we are gonna get claw hand. If it is gonna be in the shaft, we are gonna get claw hand. But when it is gonna be in the ulnar nerve, okay, I'll tell you what is this Montague fracture and Galeazzi fracture when we are discussing about orthopedics. But for now, all you need to remember is if the Montague fracture is there, then PIN. I'll tell you about this again in orthopedics, but for now, you just remember the site at which the damage is gonna happen for PIN. Okay, so radial nerve is done. Then coming to median nerve, C5 and T1 again, right? So radial nerve and median nerve, C5, T1. Here we are gonna see ape hand. I'll tell you why we are gonna see ape hand. Okay, when we are discussing in orthopedics, I'll tell you why ape hand is seen. Okay, so ape hand or the median nerve injury mainly happens in the supracondylar fracture. Okay, what is supracondylar fracture? Suppose this is the end of the humerus. Okay, so humerus was there. Okay, this is the end of the humerus. These are the condyles, lateral condyle, the medial condyle. Superior to the condyles is supracondylar fracture. Supracondylar fracture. Okay, if the nerve gets damaged here, let me tell you in the cubital fossa itself. So this is the cubital fossa, right? So here this is the medial condyle, this is the lateral condyle. If the median nerve gets damaged here somewhere, sorry, if the median nerve gets damaged somewhere here superior to the condyles, then it is gonna be ape hand. Okay, so that is the orientation that I wanted you guys to have. Okay, that's it about median nerve. So then moving down to ulnar nerve, it is gonna be C8 T1 root that it's gonna carry. So that is where we gonna see claw hand and claw hand. Claw hand, we saw it in radial nerve injury also. We are gonna see it in ulnar nerve injury also. Why? Because claw hand we see is because the extension is affected. Extension of the fingers is mainly affected. See, radial nerve supplies the posterior aspect of the hand, and ulnar nerve also gives the supply to the posterior aspect and also the anterior aspect. So the sensory part is the sensory supply of ulnar nerve is in the posterior part also. So I'll discuss all these things, why the a particular clinical feature in the ortho. But now for upper limb discussion, all I need is you guys to have the orientation for it. That is why I'm telling you. Okay, so for Klumpke's palsy, it is going to be claw hand again. It is going to be C8 T1. Okay, is the root. So this is the table I need you guys to remember. Then now that we are done with the nerves of the, so we discussed about the nerves also, right? Nerves also we discussed. Okay, so now we are done with bones, muscles, spaces, arteries and nerves, right? All and everything, you got an idea of upper limb. Okay, so one more main thing that I want you guys to remember with respect to hand spaces is carpal tunnel syndrome. The examiners have been very keen in asking this carpal tunnel syndrome because we are getting to see these features more in diabetic people. Okay, so there is a uh, this is let me give you the orientation what the carpal tunnel is. Okay, so let us think that this is the section of hand that I've taken. These are the metacarpal bones that we are seeing, and here there is a space, okay, between the flexor retinaculum. That space is known as carpal tunnel. Okay, so these are the carpal bones, and between that there is a space called carpal tunnel. Okay, so here in this tunnel, exactly in that tunnel, there is a nerve called the median nerve. We discussed about median nerve, right? Median nerve is going through this, okay? In diabetic mellitus people, diabetes people, I'll discuss about what diabetes, etc. I mean, diabetes is all about and everything, and all the complications when we are discussing about endocrinology. For now, just remember, in diabetes mellitus people, we are having the carpal tunnel syndrome, where the carpal tunnel gets accumulated with materials which causes the obstruction of this tunnel and causes compression of this nerve, okay, the median nerve. So that is why we'll be having carpal tunnel syndrome, okay. So the carpal tunnel syndrome is because of this. You got why this pathogenesis is happening, right? So this is the carpal tunnel syndrome. If they ask the question, you should be able to think, oh, okay, so there is a space in the hand where the median nerve is passing. Because of the compression of the median nerve, I'm getting some clinical features, and I'm seeing this more often in diabetic patients, okay. So that is all the orientation that you need to have with regards to carpal tunnel syndrome. Now, so I told you, right, so there are some symptoms that the carpal tunnel syndrome patients will be having. That is nothing but pain, okay, pain in the hand. So how to diagnose it? There are tests that can be done in the clinical practice itself to diagnose whether the carpal tunnel syndrome is there or not, okay. One thing is Phalen's test. Phalen's test is nothing but we'll be doing the shaking of hand, and the elicitation of pain is much common when we shake the hand. That is the Phalen's test. Then when we tap on the carpal tunnel, because when we tap on the hand itself, you will be able to like the irritation will happen and the pain will start. So this is Tinel's sign. And in Duncan's, if we press the carpal tunnel, you will be able to elicit the pain, okay. So these are the signs that you need to know before going into your exam. The Phalen's test, by shaking the hands, the pain will start. Tinel's is by tapping the hand or the carpal tunnel, exactly to be precise, the pain will start. And in Duncan's test is where pressing the carpal tunnel, you will be having the pain, okay. So Duncan's test is the diagnosis of choice, okay. Diagnosis of choice is Duncan's test. If they ask to if they give all these three options and tell you what is the diagnosis of choice, then that will be, or which is the best way to diagnose carpal tunnel syndrome, it is gonna be Duncan's test, okay. And one more major thing that they are gonna ask, definitely will ask, they are gonna ask either about Duncan's test or the content that will be spared in the carpal tunnel, okay. I told you, right, it is a tunnel, okay. So I told you that this is the tunnel and the median nerve is passing through it. So they'll not ask you those things. They'll ask you what is the content that is being spared by, which will pass above this flexor retinaculum, okay. So it is gonna be the palmar cutaneous branch of the median nerve and the ulnar nerve, which will bypass this flexor retinaculum, okay. So below it will be the median nerve, whereas the palmar cutaneous branch of the median nerve will be going above, and the ulnar nerve, which supplies the ulnar part of the hand, will also pass above the flexor retinaculum. So these are the things that you need to know about carpal tunnel syndrome, okay. So this is all and everything you need to know about upper limb. I've covered everything that you need to know with regards to upper limb, okay. So the sticky note point is axillary artery branches, and if you want, you can also write the shoulder abduction thing also, because if you if you tend to forget this, you can write this also. Other than that, write the cubital fossa orientation, as I told you, right, the lateral most part, the medial most part, in between, what are the structures that are present, so that you won't be confused when asked in the exam with regards to the orientation. or to mark the exact dissection part that they are going to ask. Then when it comes to brachial plexus, all you need to remember is the nerve roots, nerves, and the clinical feature that this nerve damage will be having. So these are the 4 points that you need to have in your sticky notes with regards to upper limb. That's all for upper limb. Thank you.